Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
The NHS will need nearly £100 billion extra over the next 15 years just to keep pace with rising demand, according to two leading think tanks. In a report out today, the Institute for Fiscal Studies and the Health Foundation say that health spending will have to go up by 3.3% a year on average over the next 15 years, just to maintain the current levels of service. In a moment, we'll speak to one of the men behind the report. But first, let's look at the historical context behind the figures out today. Well, according to the IFS, health spending in the UK has gone up by an average of 3.7% a year between 1949 and today. Recent prime ministers have increased health spending by anything from 6.1% a year on average under Tony Blair, all the way down to just 1.4% a year under David Cameron. In the general election manifestos published last year, the Conservatives under Theresa May promised to increase health funding by 1.2% a year on average. And Labour under Jeremy Corbyn said they would boost spending by 2%. But in the most recent year for which we have the figures, which is the financial year ending in 2017, health spending went up by 1.9%. Well, we're joined now by Paul Johnson, as promised, from the Institute for Fiscal Studies. Paul, why does the NHS need all this extra money?
Well, as you've just said, we've had 50, 60 years of the NHS getting significant increases, and that's partly because it's doing more. It's partly because you have to pay for the doctors and nurses, and their pay goes up in line with, at least in line with earnings in the rest of the economy. But if you're looking over the next 15 years, I think there's three things which really stand out. One is that we've had this period of very low increases, and we saw some of the consequences of that this winter. So there's some backlog to make up. Second thing is that the number of older people over 65 and particularly over 85 is growing very rapidly indeed over this period. And of course, there's a lot more spent on older people than there is on younger people. And the third thing, which is very striking, is that the prevalence of chronic diseases, the number of people who are being treated for things like diabetes and asthma and so on, is going up really quite fast as well. So you put all of those together, and it would be very surprising, actually, if we didn't need increases at least or close to the average for the last half century.
And bearing in mind the amounts that we're talking about are extremely high, you say in your report it's hard to imagine raising this kind of money without tax rises. Is there any other way it could be done? Could any more be cut by departments, or really are we looking at the main income tax rises?
Well, if you look over the last period, I mean, actually over the last 50 or 60 years, we've had this very big increase in health spending from about 3% of national income to well over 7%. So that's a really, really big increase. And we've actually done that without raising taxes. And the way we've done that is essentially by almost abolishing defence spending, not spending anything on building houses, big cuts actually in the amount we spend on debt interest. And even over the last 7 or 8 years, health spending's been tight, but it's done better than other bits of government. So to some extent it's been protected because all sorts of other things have been cut. If you go forward, I can't see, honestly, what are the other big bits of government that you could cut? Where could you get tens of billions? Not from cutting schools, I don't think. I mean, local government and prisons and police and so on have been cut dramatically already. So I do think if you're going to spend this extra money, it will in the end have to come from higher taxes. And the big taxes are income tax, national insurance and VAT. And it'd be hard to see how you could get the kind of scale of resource without one of those at least bearing some of that burden.
Give us a comparison to other similar countries around the world in terms of our spend on health.
We're actually extraordinarily average in pretty much all ways in terms of how we fund health and how much we spend on it. We're about average for the rest of Europe, and we have about average outcomes. The NHS, despite our sort of national love affair with it, is actually a very average kind of health service. Now, I don't mean that in any pejorative sense. It's just that we spend about an average amount on it. We do quite well on some measures, we do quite badly on other kinds of measures, but across the world, most health services are paid for and provided much the same way as that they are here, by taxes as a public service, and they've grown over time as populations have become more demanding and as they've become bigger and older.
Thank you very much. Well, we asked for an interview with a minister from the Department of Health about today's report, but no one was available. We are joined, however, I'm pleased to say, by the former Health Minister and Conservative MP, Dr Dan Poulter, and by Andrew Haldenby from the centre-right think tank Reform. Welcome to both of you. Dan Poulter, listening to that, do you think the government will give the health service a big cash injection?
I certainly hope so. It's much needed and long overdue. It's very clear that the service has been struggling to meet increasing demand for a number of years now, and I think just to stand still, it's going to need, I think, this a substantial increase in funding year on year, probably 3, 4, 5% as a minimum, in order to deliver the services that patients deserve. But the other point I think that needs to be made on this is that that's probably just to stand still. If we want to transform services and deliver more care in the community and do more in mental health, which is something close to my own heart, then we're going to have to put pump priming in place and extra money to do that, and proper capital investment. And at the moment, too much of the money from the capital budget is being raided to go into propping up services, particularly during times of acute winter pressure. That's got to stop. We've got to have longer-term thinking and a longer-term sustainable financial plan, which is something I'm sure most MPs would sign up to. And if that means putting up taxes, and I think there's a good case for that, then that's what we've got to do.
Right, so let's just clarify. You talked about 3, 4, 5%. Are you saying actually you'd be willing to see higher increases beyond 5% in order to do more than just stand still?
Well, we've got to match up the rhetoric to the reality on the ground, because there's a lot of rhetoric about let's have improved mental health services, let's deliver more in the community and care for patients with long-term
integrating
conditions.
social care.
Yeah, and at the moment, because of the pressures on local authority budgets, the pressures on NHS budgets, integration isn't happening, and in fact the very opposite's happening. There's retrenchment amongst those services. So if we want to transform services in the way that is the rhetoric has been talking about, we want to improve the integration and joined up care for the patient, and also realise some of the potential financial benefits of those that integration, then we've actually got to pump prime that and put the money into the system to deliver it.
Right, we're talking about big increases here, Andrew. Do you agree that the NHS needs that money, and would you like to see it receive something in the region of 5% increase?
Well, I think that's too much. Looking at the report today, it calls in the end for an increase in the basic rate of income tax of 10p in the pound, from 20 to 30p, to fund the increases in spending it talks about. I mean, I just think to say that, I don't think any of us would expect any government or any political party to take that in a manifesto at a general election and expect it to be politically persuasive. It's you know, I just think it's just unrealistic.
Well, what do you say, Anne?
I disagree entirely. The people love the NHS and they understand, as Dan does, and I want to congratulate Dan, by the way. I live in Suffolk and I have a member of the family that uses Suffolk Mental Health Service, and Dan has been a champion of that service. People love their National Health Service, and we know it's utterly affordable. If it was affordable to bail out the banks in 2008, it's affordable to bail out the health system.
We did a poll to find out where public opinion is on NHS tax rises. It's true the public does want to pay higher tax.
They do.
But in the poll that we had, it's somewhere between 0 and 1p. So it's a limited amount, it's a limited amount, not the 10p. So I think that the government will probably put this report to one side because it's just too much. The question it will be asking, is within a sustainable spending and maybe small tax increase that the public wants, how can it achieve the efficiencies within the existing system which the NHS has promised but not delivered for many years?
Let me just come back to Dan. I mean, listening to that, do you think it is politically palatable to ask for that much to be put on income tax?
I'm not sure I entirely agree with those figures, because I think you can raise several billion just by putting a penny on income tax, or on national.
More than several billion, though. If we're listening to Paul Johnson, we're talking tens of billions
or
here.
National insurance. But I think that's got to be the start of the conversation. And I believe that if you put an argument about do we value the NHS as a public service, do we value the fact that we have a service that's free at the point of delivery for everybody, and do we want an effective and efficient service that actually that cares and looks after people, I think people would sign up to that.
But that is a big increase. If we're talking about 10p,
yes.
People, I think, from all the recent polls, have said they would like to see more money go into the health service and into education.
Right.
But when asked specifically how much it might cost them every year, they might not be quite so willing to pay the sort of increases you're talking about.
No, you see, I think Paul Johnson misleads us by saying that the government pays for the health service from a vault of money that it's got in the bank called HMRC, where we have tax revenues. We don't pay for the health service from tax revenues. We pay for the health service by issuing gilts in the international capital markets, and we do that every week. And it's very successful. We raise finance at very low levels. That's spent on the health service, and as a consequence of that spending, we collect tax revenues, which helps to
So
pay.
are you saying we wouldn't need that sort of rise in terms of taxes? What do you say to that, that actually there is this idea that the government, successive governments have put to us, it's our taxpayers' money that funds it, would have to go up?
I mean, of course there's going to be a difference in politics on this, but the last time...
What about the economics?
Well, the last time the NHS had a really colossal spending increase, which was under Tony Blair and Gordon Brown, the national debt was about 35% of GDP.
And satisfaction with the NHS years later went up quite demonstrably.
No, indeed. But the point was the public finances were robust. Now it's 80%, and Anne may be more relaxed about that. I wouldn't be, and lots of, I think, people in the Treasury would not be relaxed to borrow at this time.
I'm not at all relaxed about it, but it's not because of the NHS. It's because of the financial crisis in the banking sector. So you can't blame the NHS for the fact that the public debt has risen. We've got to manage the finance sector, and then we could afford the NHS.
Because it's about choices. And in the end, it seems, Dan, that you have come round, or maybe you always felt that way, that actually without high levels of cash being injected into the NHS, there'll be a decade of misery in which the old, sick and vulnerable will be let down, according to the NHS Confederation.
Well, we can see at the moment what were a few years ago winter pressures in the NHS are now year-round pressures, and we see that in the shop window of the Accident and Emergency Department. That's a shop window of the health service. So there does need to be a step change in funding, and there needs to be a long-term sustainable funding settlement. We cannot go on having just quick fixes year on year, and we need to see, I believe, as a start, where there's a general consensus around a small increase in tax to actually help to fund the service, to keep it at least at the level we're at the moment, and then longer term we have then the opportunity to have a sensible discussion about how we can actually sustain the service in the future. Let's remember, it's not that controversial, because our health spending is about 7.2–7.3% of GDP. In many other countries in Europe, it's actually near 10%.
Yeah, but let's have a look at the figures. Let's have a look at the figures under recent prime ministers in terms of spending on the NHS. I mean, you can see there 6.1%. They were probably record levels of spending under Tony Blair. But look under David Cameron, down to 1.4%. I mean, was that ever justifiable? You were a minister during that time.
Well, we recognised at the time that we had a very difficult financial situation in the country, and even in those tough circumstances, we managed to put a small real terms increase in NHS funding.
But isn't it because of that we're facing now the shortfalls we are?
But it was never envisaged, I don't think. And actually, the funding squeeze initially started, and it was the funding plan that was agreed to squeeze and funding initially started actually under Gordon Brown's time as Prime Minister, and David Nicholson, who was then the Chief Executive of the NHS, recognised there were going to be some difficult years ahead, and that actually efficiency savings needed to be made.
Right, we'll come on to the efficiency savings in just a moment, actually. Andrew.
Well, I was just saying, to be fair to Dan, when he was a minister, there was 1 year where the government put in £4 billion, so a very big injection that was designed to modernise the service. It didn't really work. Well, I think that's another reason why the Treasury will have pause.
Yes, and just on that, before we move on to Labour figures, isn't that the problem? I mean, giving more money to the NHS if it didn't actually perform the efficiency savings that it was meant to, is that the right way to go?
Well, the point is this, I mean, I don't know enough about the efficiency of the NHS. I can't say I'm an expert on that, Joe. But the fact of the matter is that you can't get the service to pay for itself. The service has to employ people. It's a people's business. And people, the wonderful thing about it is that the people who are employed, whether they be cleaners or nurses or doctors or surgeons, pay taxes. And they don't pay taxes 1 month a year. They pay for their whole duration of their employment, which helps to pay for the investment that the government puts into it. So this is a multiplier.
Yes.
So it pays for itself, the NHS, because it employs so many people. If we invested in something which didn't employ people, we wouldn't get the benefit of tax revenue.
Right. Before I let Andrew come back on that, let me show you some figures of Labour spending, because if you look at what was proposed under Jeremy Corbyn in the last manifesto, it's only 2%. And I only say only because comparatively looking at what was spent under Tony Blair, or even looking at the government.
Yes.
I mean, the government are looking, I think the last year was 1.9%, I said. So why so modest from Labour?
No, I think it's incredibly low and disappointing. But I think it's a function of the debate that we're having, which is that to spend on the National Health Service is considered a political suicide. But that is not correct. What came out of the election was that people really want him to spend more. So we've really got to put pressure on him to do so.
Just one quick point. I mean, when Tony Blair invested that money, it made a massive difference to the health service. We saw that we were, when Labour came into power, waiting times for, operations were, for many, many months. Waiting times were reduced. We saw that the investment in cancer services and many other services was extraordinary, and it made a real difference. The ability for doctors and nurses to deliver the care.
So investment works, doesn't it? You do get a return.
Of course, but it's always a question of how it's done. What people at the time, ministers at the time like Aradazi, have said since is that all that money built certainly a better system, more care in hospitals, but that's turned out to be the most expensive and in some ways a slightly out-of-date way of spending the money. So again, I just think if the Treasury can just be so cautious and can think, yes, we will spend more, but we'll only do it on the basis of getting a modern system, then I think that's the right way to think about it.
Do you welcome the idea that is being talked about that the Andrew Lansley, he was a former health secretary, the reforms that he brought in, called a top-down reorganisation, was heavily criticised at the time. Do you think that would be a good thing if that's unravelled?
The honest truth is, those reforms and the changes to them, I don't think anybody even understands what they are now. So who knows?
Well,
but what I would say, hold on.
We all know that it was about privatising the NHS.
It wasn't. But what I would say is that what the NHS has to be is got to answer to someone. It's got to answer at the moment to the Secretary of State. I would give much more power to local authorities and put local people. Put them really in charge of local services.
Was it a mistake? Were they a mistake?
Well, I think the mistake in those reforms, there's some clear mistakes in the fragmentation of, say, for example, addiction services and giving those to local authorities, which I don't actually agree with the last point entirely, and moving them away from mental health services. That's affected patient care. It's also, I'm sure, contributing to some of the issues we've been talking about recently in Parliament on homelessness. But the big issue with the Lansley reforms is it took the eye off the ball of the need to make efficiency savings in the service at a time of financial restraint. And the whole service was focused on reorganisation rather than actually on delivering patient care.
It was a misguided policy.
Well, it was misguided in that, I mean, at the time, it would be much better to have focused on working with what we had and actually delivering better efficiency savings. There are some positives, though, from the Lansley reforms in that we now have CCGs, which are fundamentally led by doctors, by clinicians.
At the same time, there's been negative impacts, which is, the privatisation of NHS property services means that the NHS is now paying much higher rents for the rent of their own property, which was bought in the first instance by taxpayers. And now a private sector has those properties and collecting massive rents from the NHS, which partly explains why there's such a deficiency.
Very briefly.
Although, I mean, the reason that was brought in was to help the NHS make better use of its property, which is quite an important objective.
It's just milking the NHS of money for those who own the land.
We have to end it there, I'm afraid, but thank you very much for coming in.
Well, let's stay with that. And the Institute for Fiscal Studies and the Health Foundation say our ageing population means health spending will have to increase substantially over the next 15 years. Sky News also understands that hospital trusts in the NHS will report a combined deficit of over £1 billion, twice of what was initially thought. Well, I'm joined now by Jamie White from the Institute of Economic Affairs and also Chris Ham, Chief Executive of the King's Fund, an independent charity working to improve health and care. And Chris, to you first of all, health spending needing to go up around 4% over the next 15 years, costing around £2,000 per household. Do you think that's a realistic figure? Will it be enough?
Well, the first figure is certainly realistic. The NHS needs to have an annual uplift of around about 4% of its budget because the population is growing, it's ageing, people have more complex needs. We've seen on our TVs during the winter how hard staff have had to work just to keep pace with that growing demand. And this is a wake-up call for the government. It's put a number on it. We can debate whether that's the right number for increased spending or not, but certainly some taxes will have to rise. We wouldn't necessarily subscribe to the £2,000 increase in income tax per household. That's debatable. But if you don't raise the money there, you need to look elsewhere to fund the NHS in the way we all hope it can be.
Jamie White from the Institute of Economic Affairs is increasing taxes, is costing each family potentially as much as £2,000. The only way to get this kind of fund?
Well, no, I don't think tax should be increased for this purpose, but I want to show...
Sorry, we missed what you said at the beginning there. Apologies, Jamie. Could you say that again?
OK. I don't think tax should be increased for this purpose. I want to first talk about a fundamental flaw in this kind of analysis. And the way to see it is to ask yourself, well, why increase spending on the NHS only this much? Why not increase it by even more, increase tax by even more, and have even more healthcare? Or maybe less. The problem is that these numbers, they're picked out of there, they're arbitrary targets for the amount of spending. And it has to be that way because in the NHS, there are no real consumers who can express their preferences. And so we get arbitrary decisions about how much of our money to spend on healthcare versus other things. And so long as we have this crazy system where healthcare is funded from taxation and consumers have no say in the matter, we will always have arguments about how much is spent and arbitrary decisions being imposed on the population. So we need reform of the whole system, not more spending put into a basically misformed system.
Chris, do you think that's a fair point? I mean, when we look at what the NHS trusts are going to spend, Sky News has discovered today that they're going to be spending about £1 billion, which is twice as what they thought they were. Isn't this all largely guesswork?
No, it's not guesswork. The modelling on which this report is based is quite thorough. The Institute of Fiscal Studies well respected for the quality of the work it does. We can argue about the detail, but there's no argument that this is the sort of increase the NHS needs. And people can express their preferences. They do that at the ballot box. And we've seen through survey evidence now a majority of the public, including a majority of Conservative Party supporters, say the NHS needs more funding, and they would be willing to pay more in taxes if they know that money is going to go into the NHS, and I would add social care too. The debate then is how to raise that money and which taxes to use to fund the NHS in the way that will deliver rapid access to high quality care, which is what we all want and expect.
Jamie, you might not like the idea of... Sorry, Jamie, I was just going to say, you might not like the idea of funding the NHS with this model, but it's the model that exists and we have to go with it, don't we?
Why do we have to go with it? We can change the model. The idea that we express our preferences through the ballot box is crazy. I mean, let's take something else. Take food. How much should we spend on food? The idea that I should express my preferences for spending on food by voting on a collective decision that will be imposed on everybody is nuts. This is the Soviet approach to the allocation of goods and services. And there is no economic analysis that can tell you what the right number is. The right number depends on the preferences of people. And collectivizing these decisions through a democratic process is frankly crazy. If it's such a good process, why don't we apply it to everything?
So Jamie, what's the solution? The privatisation of the health service, using a health insurance system like they have in America, perhaps?
Yes. Well, the American model is very badly designed as well, but you would normally pay for things, when you have unexpected expenses that can be quite large, you normally cover them through insurance. And insurance would be the way we would probably do things if we privatised the system. That would cover large health bills, smaller health bills like going to the GP and so on, people would pay out of their pocket. Singapore has a system that works very much like this, and they have a much more efficient delivery of healthcare than we do here in the United Kingdom.
Chris Ham, the politics and the morality of whether our health service should be free at point aside, if the health service was funded by an insurance model and therefore we didn't have to look to taxation, could that not be a better way of funding the system?
No, not at all. If you look at the international evidence and the experience, all civilized countries that value their populations go for a public insurance model, because Jamie is wrong. We have an insurance system. It's just a public insurance system because private markets have failed to deliver the protection that everybody expects in relation to healthcare, where the costs of care can be truly astronomical, and that's why the NHS is so highly valued by the public. Just look at the survey evidence. evidence. Ipsos Mori shows that the thing that makes us most proud to be British is our dear National Health Service, 70 years old this year. We must preserve it because it's so important to all of us, and that requires an injection of funds and the taxation that will deliver the degree of protection we've expected since 1948. The private market will not deliver that for us.
Jamie? You're shaking your head.
Well, I mean, can I opt out? I mean, I don't like it, but I'm forced to fund it. This idea that we're proud of it, therefore everybody must go along with it, it's a very strange argument. It's also certainly not true that the private markets can't cover health expenses. When you think about it, it doesn't really make any sense at all. The expense is there, whether it's even if it's provided publicly, it's got to be paid for. The costs don't magically go away because of they're tax funded. What goes away is the ability of consumers to express preferences. So when you say we have a public insurance system, that's true. My health is insured by the state. However, I don't get any say in what kind of insurance that is, what's covered.
But Jamie, what's more important? Is it more important that consumers have choice, or is it more important that the poorest in society who can't afford insurance are provided with the same level of health care as the wealthiest by a taxation across the board?
Well, if you're worried about inequality, you can fix that problem by transferring cash to people. Then when they've got that cash, they can make decisions about their priorities. So they can decide for themselves whether they want to spend more on one thing and less on another, or the other way around. When you take the approach that we're taking now in Great Britain, not just on healthcare, but on many things, including education, you don't just redistribute wealth by this process, you take away people's ability to live according to their preferences. And so it's not just that it's redistributive, it's that it compels consumption of a certain kind. So it's not good even for poor people, because it takes away their choices as well.
What, that they may choose not to spend their money on healthcare, but they might choose to spend it on going to the cinema?
They may have different preferences, yes, and different people have different healthcare needs, and they have different likelihoods of needing care in the future. They give health different weights compared to other things. The other advantage when you have choices and face prices is that you adapt your behaviour. So you may have an incentive to give up smoking, to keep slimmer and so on if you faced a price. Because we don't face any prices in the UK, people have no such commercial incentive to look after their health. OK, well, you're going to have to leave it there, I'm afraid. I know Chris Ham is shaking his head from the King's Fund, disagrees fundamentally with what you are saying, Jamie, but very good to have you both on. Jamie White from the Institute for Economic Affairs and Chris Ham from the King's Fund. NHS campaigner Dr Bob Gill, who joins us now from Westminster. And Dr Gill, we were talking about this around half an hour ago with the Institute of Economic Affairs, and they were suggesting that the model of NHS funding is broken, it needs to be changed. Do you think we need to look at a different way to fund the NHS?
Well, if you look at the funding structure of the NHS, it's funded through taxation, and largely the original model, it was all delivered by public servants, and there was no profit extraction. But what's happened over the last 30 years is the NHS has been gradually marketised and bureaucratised, and also saddled with private finance initiative debts. What is missing from the report that you've already put out is the drainage of money away from patient care because of the burden of private finance initiative, which we borrowed 11 billion and the taxpayer has to pay back in excess of 80 billion, and the market bureaucracy, which has gone up from 5% of the total budget in excess of 20%. And if we continue down the route that the government is taking us to the American model, that will be in excess of 30%. So I'm quite surprised that the IFS has failed to mention where the money is going and to burden the taxpayer with more tax without fixing the leaks. These are massive holes in the NHS budget. Without fixing the leak and the hemorrhage out of the NHS budgets, then they're off to the wrong destination.
Well, the IFS does say that the reason that the NHS is spending so much more money is because of our ageing population and because people are living longer, they require care for longer, and it's social care as well as medical care, and that money has to be found. It's money that was not accounted for.
Well, this is another narrative that is overstated. People are living longer, but they're living longer, healthier lives. They're contributing to society. They're providing childcare. They're providing support for younger working family members. The amount of time that people are dependent on the state for care and for medical intervention is relatively static. So they have to come up with some sort of plausible sounding narrative to sell the reforms which are taking us to the most ineffective, inefficient and fraudulent system, which is the American system.
But taxing people more, which is a suggestion that this could happen at up to £2,000 a household, it can't just go on forever, can it? We can't just keep increasing taxes to fund the NHS.
Well, another factor that is forgotten is if you invest in health, that is actually an economic good. For every pound invested in healthcare, it returns £2 or £3 to the economy. That's called the economic multiplier effect. So this is not money just wasted. You're restoring people to health, you're restoring people to become productive in society, to look after children, to look after other family members. So this is not a waste, this is an investment. But if we only look at how we raise tax and raise funding and forget to look at how money is being squandered on marketisation, then I think we're only looking at half the problem.
OK. Dr Bob Gill, we're going to leave it there. Thank you very much.
Thank you.
Joining us to talk more about this is Junior Doctor and Chair of the British Medical Association's Junior Doctors Committee, Jeeves Wijasiriya. Jeeves, thank you very much indeed for your time. How do you react to the report today? £2,000 a year for each household. That's not great news for taxpayers, is it?
I think what we can see is that these figures show just how critical the crisis in our NHS has become. Congestion and delays are having a profound impact on patients' experience. And as our population ages and presents with more and more problems, we can see that, as this report shows, our health spending lags behind that of other similar European countries. And actually what we need to do is really start to match that funding.
There is an argument that, you know, it's not just a matter of pumping a little bit more money in to get top quality care. Compare it to places in Europe with social health insurance systems that go from patient to provider, and they have much better outcomes. Simply throwing more money into the NHS is not going to make the service equal to or greater than some of those other countries we compare ourselves to.
Well, I think often these two things are conflated. In reality, the NHS is a much better service on nearly all measures than it was 20 years ago. It is more productive now than it has been in the past. The difficulty is that, unfortunately, we still haven't matched our funding to keep up with the demand that our population, our society, our patients need from us. The reality is that, you know, what was once a winter crisis is now a year-round crisis. And because that demand has increased and our funding and our resourcing hasn't matched it, we're finding that now, you know, 80% of doctors are saying that they are working in places of work that are under-resourced. You know, 60% saying that their workload is increasing year on year with each winter. So actually, I would suggest that our health service has a fantastic model of delivery, but we need to give it the resource and funding to be able to keep up with what has been increasing demand for some time. And what is so welcome about this report is it identifies how what we are suggesting in the initial stages might well be matched to make up for the deficit there has been over previous years.
Part of the demand, of course, is people living longer and being ill when they live longer. And social care, of course, has been a real point of focus for everyone concerned about the NHS. If we're talking about £2,000 a year per household, do you think the time is ripe in terms of the British voting public being in favour of some sort of hypothecated tax if they knew it was funding social care?
Well, I think what's clear for everyone is how passionately people feel about our health service and the care that it provides. You know, you've pointed out that we do have a population that is getting older that has, you know, multiple different problems, and across society, actually, I think that is a sign of the success our health service has had in treating people, in the care that it provides, advances in technology, advances in care, and steps we've taken in terms of public health. But the reality is we know that this is a core issue for many people. And really the question for politicians, the question for our government now is, you know, Are we prepared to match the funding that is required to make sure people get the care they need? And I think that's such an important question for us to now ask. We know that it's been a subject of so much debate, and certainly something that health professionals have called for us to start to address.
Do you think that when we discuss additional funding for the NHS that we do need to talk about the problems that exist within the system that you say, is broadly working well, has done better than it has done for 20 years, and it's a system that does work well? There are a lot of people that disagree in terms of mismanagement and wastage and things that could be fixed, but we never touch these things because it's a 4-year voting cycle and the NHS produces such emotive responses from everyone.
I think you make a fantastic point there about needing a long-term plan, something that health professionals and organisations like ourselves at the BMA have been calling for some time. As you can imagine, for people working in the health service, we are on a constant drive to deliver the best possible care with ever-dwindling resources that don't match the demands, the needs that our patients have. So for many of us, we are seeking that efficiency, that ability to deliver the best care all of the time. I think what we need is resourcing and funding that matches up to that need. Because
but it seems like certainly with the health secretary at the moment, Jeremy Hunt, and indeed increasingly the Prime Minister, he seems to be winning the argument for putting a bit more money. So you think he's doing a pretty good job at trying to get on side with what you're talking about?
I think it is so important that government recognise the issues that we're talking about. I think it's so important that that dialogue is there. I think it's important that we're starting to see recognition of the scale of the problem and the fact that resourcing and funding is so needed.
Oh, Jeeves, we just lost that last couple of words, but thank you very much indeed for your time. Appreciate it.
Taxes will have to rise to pay for the NHS if the UK is to avoid a decade of misery in which older and more vulnerable people are let down. That's the conclusion of a report by 2 think tanks, which says the health service will require the equivalent of £2,000 a year from every British household for more than a decade. Our political editor, Laura Koonsberg, has more details.
Care costs more and more. Hospitals in the red, waiting lists at record levels. Today's demand to ministers: act now to avoid a real emergency.
If we want a good health and social care system over the next 15 years, we are going to have to pay for it. We cannot go on as we have done over the last 10 years, which has basically meant a few billion here and there and the system not really managing to cope.
Next year's spending already is set at £154 billion. To keep up, the verdict is the NHS will need an extra 3.3% every year, a huge £95 billion over 15 years. But for the service to improve, the price tag is at least 4% extra each year, £124 billion more over that time. That's a hypothetical extra £2,000 in tax for every household.
Any government knows what happens on wards, in surgeries, in hospitals around the country is one of the things we all care about most. So, if evidence piles up that the NHS needs more cash, surely it's simple. They have to act. But writing big cheques with taxpayers' money is anything but. The Prime Minister has already made a big promise to find more money for the NHS and to guarantee it for a decent length of time. But ministers are a long way from agreeing how much, for how long, and how to pay.
It took many months for Theresa May to come this far.
We need to get away from those annual top-ups of the budget that we've seen, and we do need to have a sustainable long-term plan.
Finally agreeing with the Health Secretary that the NHS in England needs not only extra money, but year after year after year. Yet where can the Chancellor find it? Extra cash, more cuts, or borrowing? Things are tense.
How much more money should the NHS get? Are taxes going to have to rise?
Very nice to see you.
Nothing to see here, of course.
The NHS has to do reform as well as get resourcing. I think there is a very ferocious argument going on in Whitehall. The Prime Minister basically seems to have made her mind up that the NHS has now become a political issue and that something has to be done. The Chancellor may well be in the same position, but he doesn't want to really open the chequebook. The Health Secretary knows the situation and is demanding more cash.
The Prime Minister wants a deal in time for the NHS 70th anniversary in July. But there's no guarantee it will be ready or feel anything like a gift. Laura Kunzberg, BBC News.
What kind of health service do we want for ourselves and our loved ones now and into the future? If the answer to that is a better one, then independent economic analysts think that could end up costing every household an extra £2,000 in higher taxes.
Winter for this hospital in Milton Keynes was one of its worst. A&E was overstretched, operations postponed, and patients had to wait for hours to be seen. The solution, we're told, is more money. Billions of pounds worth of more money. And without it, the chief executive here believes lives are at risk.
I think it's definitely challenging patient safety, and from a Milton Keynes perspective, we know that the care that we're providing when we're under pressure is much, much harder to do at the highest possible levels. So absolutely yes, if we can release some of that pressure and make sure that we are looking after the appropriate patients with all of the appropriate resources, that's fantastic.
Will, though, the Health Secretary come up with the goods? Tonight he confirmed a plan is being drafted and said if taxes had to go up to pay for it, the public would support it.
Poll after poll shows that they do recognise that through the tax system we will end up having to contribute more, and there is a willingness to do that, providing they can see the money going to the NHS and providing they can see that it's not being wasted. I think from the Chancellor's point of view, he well understands that.
But how much will the NHS get? A new report says the current £150 billion spent on the NHS in the UK would need to increase by over 3% per year over the next 15 years to maintain current provision, or by 4% to fully modernise and improve it. That would equate to an extra £2,000 per household each year by 2033. How then could the government get that sort of money?
In the past is that we've paid more and more for the NHS without having to raise taxes, and that's because we've essentially stopped spending much money on defence, on housing, on debt interest. Going forward, very hard to see that there's much left to cut. The only way really is to increase taxes.
This year, the 70th year of the NHS, is a critical moment for the service. So far, there's been very little appetite from the government to commit to any long-term plan, but many feel with attention turned to its future, now is the opportunity to fundamentally change the way it's run and funded. Emily Morgan, News at 10.